Urinary system. When we look at the outer part of the kidneys, we'll see that renal hilum, which is where the ureter carries urine, and we're going to get to that. The renal capsule surrounds it. But deep inside the body, here we have the kidney. Main function is to filter blood. And to do that, blood is pumped with each beat of our heart through these arteries into a small capsule, the glomerulus. You see, much of today's lecture is about this capsular structure called the glomerulus. You see those red vessels? They have tiny slits in them, and through those slits, blood is going to be pumped, and our body is going to capture the blood cells, proteins, anything that's valuable. It's going to go back into our bloodstream. Those are peritubular capillaries, and you see they're surrounding the nephron. Their job is to trap anything valuable that diffuses out of the nephron. You see, our body doesn't want to waste good cells and proteins by urinating it out, and so these peritubulars are going to capture it all. Now, we do have something called nephroptosis, which is when the kidney slips from its normal position. And usually there's fibrous bands in adipose. But when this happens, the ureter, which we're not seeing in this video right yet, but pretty soon there's going down the collecting duct on the way to ureter. If the ureter is twisted, then we have some backward pressure in the kidney causing problems. Wow, that was some great footage. Internal anatomy. Let's look. We just took a view of the internal structures. The renal arteries are going to branch. So let's take a look at this picture here. They're going to branch into tiny afferent. And when you see the word afferent, think of towards. And efferent, look at that E. Think of exit, away. So what I'm trying to say is there are blood vessels that are bringing blood to the kidney, and then there's blood vessels that are going to carry it away from the kidney. And why is that? It's because the ones carrying it away from the kidney are carrying the things we want. And I'll get to that, all right? Renal cortex is the place where the kidneys, where blood is pumped from the body, enters the nephrons. I'll get to that too. So this is just a little preview. Some of the nephrons also extend into the deeper layers. So I'm going to take this step by step. We sometimes have renal failure, and if it's acute, that, even though it sounds terrible, it's often a good thing because usually it's a temporary condition caused by a heart attack or some kind of dehydration, infection that restricts blood flow to the kidneys. But chronic is what many people suffer from, chronic kidney disease. That progresses slowly due to cystitis, which is a urinary tract infection, poor control of diabetes, overuse of some drugs, just sometimes simple anti-inflammatories taken over a period of many years, hypertension, may lead to permanent failure, and then we go through hemodialysis where the blood is filtered, doing the job that the kidneys normally do. Calyces, take a look at the calyces here. These are where new formed urine occurs from the medulla and onward to the renal pelvis. So here's the renal pelvis. None of this is labeled in this particular drawing. And some of this we'll see later. Kidney stones, uric acid, calcium salts, oxalates. They're going to harden into crystals in the renal pelvis, which is this area, this brown area here. And in many cases, we can just watch and wait and let them pass through the ureter here, bladder and urethra. But sometimes lithotripsy is used. We use this kind of a sonographic waves to try to break these stones into fragments. There's also baskets and other devices that you can use. The nephron, which is what we saw the video, is the first structure is called the glomerulus. And here are those tiny slits I talked about where blood is going to be squeezed through and they're going to enter the nephron. Now, whatever can't squeeze through goes through the efferent because we want to keep that. What can't squeeze through? Well, white blood cells, red blood cells, platelets, some of the big proteins. We don't want to urinate those. So we don't want them to go through those slits. And if they do, that means we have some kind of disease going on. such as glomerular nephritis, inflammation of the glomerulus due to all sorts of reasons, bacteria one of them. The inner tissue is going to swell, but the outer renal capsule, which is way out here, doesn't stretch. Okay, so even though it's protective and it does a good job, if there's any inflammation, then there's nowhere for the edema, the pressure to go, and so the pressure builds up and may destroy some of the fragile tissues. I think I mentioned the Bowmans capsule, or glomerular, that's the new name, and that's just a protective structure around the fragile glomerulus, and those are those blood vessels with tiny slits. Now blood is going to squeeze through. I mentioned the efferent. The materials we want to keep, they go right back out. But the materials we want to filter are going to go into the proximal tubule, and it's called filtrate here. And much of the valuable substances in urine, well, it's not called urine yet, that in blood is going to be absorbed right here in the proximal tubule. So this structure is right here, proximal. All right, so these are those peritubular capillaries I talked about in the video. They're going to surround the nephron, and they are going to absorb substances that diffuse out of this nephron. Yeah. So there's waste and toxins that we don't care about, but there's valuable substances like water, glucose, amino acids, some of the mineral salts that we want to recapture, and here's our chance. Reabsorption. This is going to occur down around the what we used to call the loop of Henle. Now it's called the descending limb of the nephron. And what's here is it's really salty. Okay, take a look. We're in near one of the calyces of the kidney, and there's a salty region. So water is naturally going to flow from high water concentration to low, and we get this outward flow of water because water is valuable to the body. And here's a chance for us to capture it. Secretion is on the way up. We're past the loop of Henle, or ascending loop. And now we get to dump some of the materials that we don't want out of the bloodstream back into the nephron. So sort of like the garbage truck is driving by your house and you're going to dump some of your garbage in it. That's what we're seeing. So the blood vessels are here. They're not showing up on this image, but just imagine blood vessels dumping into here. Now, if you have polycystic kidney disease, sometimes it's going to interfere, and you can see as people get older, these cysts enlarge. And so sometimes as children they are fine, and then later as adults there's a need to have a kidney transplant. Not always, okay? Not always. Distal, okay, so we did the proximal, we did the descending, or loop of Henle, we did the ascending. And so now we're getting near the end. Okay, now we have real urine. There's nothing in here we want except maybe some water. And so we have this ADH, antidiuretic hormone, at the distal tubule. This is our last chance, okay? If we want to get something out of this, this is our last chance. So if we're dehydrated, then our body produces ADH, and it's going to cause water to flow out of the distal tubule, and it ends up in the bloodstream. So we can influence our blood volume and even our blood pressure at this point. That's why, you've been sleeping a long night and you wake up and your urine's really deep yellow. That is often because ADH has been telling your body to conserve water like from midnight on. And so now you have this really dilute, concentrated urine. And that's the same reason if we're ever lost in the desert, we never drink our urine. I mean, some survival experts drink their urine, and it's incredibly foolish because this concentrated urine has nothing in it anymore of any value. Okay, it's wastes, and that's it, man. I don't know. I'll move on here. Urination. Okay, we take it for granted. So here we have the ureters coming down from the collecting ducts of the nephrons. And so now we're out of the microscopic view, and these are things we can actually see. Here's the urinary bladder. There's an internal urethral sphincter that's going to open as this structure fills with urine. But Thankfully, it doesn't get to be the boss. Otherwise, we'd wear diapers all the time because we have an external urethral sphincter under skeletal muscle control, and that allows us to decide when we're going to urinate. STDs, they don't just go through the sexual organs. Some may infect through the mouth, anus, other mucous membranes, such as the eyes. It happens. A lot of people think the world is safe, and they watch and they think Hollywood, you just go off and have sex a lot. But really, there's a lot of STDs out there, like chlamydia. It starts off with these painless sores and swollen lymph nodes, but it may lead to sterility. I try not to use actual photographs for showing chlamydia because they are some of them are pretty frightening. About 80% of the women and 40% of the men don't even have symptoms in the early stages. So they're off spreading this organism to others. Gonorrhea, that's the middle picture here. We think of pus, either from the penis or from the vaginal area of a woman. Often early stages are asymptomatic until the bacteria is moving internally. It doesn't just stop, it doesn't just stop at the cervix or testicles. It may move into deeper tissues. Gonorrhea, many of the strains are resistant. They're highly resistant to antibiotics, so it's not so easy to treat anymore. Syphilis, we think of cankers, and let me tell you, this is one reason we glove up in a hospital, is because these cankers are packed, man. They're loaded with active bacteria. So this patient is highly contagious. Everything they touch, the sheets, the bedding, is loaded with these. And advanced stages, they may affect the eyes, bones, nervous tissue, and cause death. Not a pretty disease. Bladder disorders, not quite so frightening. In fact, they're pretty common as we age. Look at this. It's kind of what we call herniation. You see the prolapse on the far right? What's happening here is, and it's a somewhat natural process in many people as they age, the bladder is going to drop because the wall is weakening here. And as it does so, it opens the urethral opening. It's more of a problem for women because of the short urethra. And so we get some leakage. Benign prosthetic hyperplasia, only a problem that men have because we have this prostate gland that surrounds the urethra directly below the bladder. And as we age, testosterone just keeps pounding away at this, causing a swelling. Now, it's not cancerous, although cancers do form in the prostate. So you gals, be patient with your men as they get older. It takes them a long time to empty their bladder sometimes. And they get up a lot at night. That too. Incontinence, there's different types. There's urge incontinence, which is just, it's due to diabetes, stroke, dementia, other conditions that affect the muscles. I talked about the smooth and skeletal muscles there. Stress incontinence, and that's what we see in cystocele, is often sneezing, coughing, laughing, and also pregnancy, childbirth can cause some of the weakening of the pelvic floor and the sphincters. UTIs or cystitis, we think of STDs, chlamydia, but also organisms that occur in fecal matter, and this is why we teach our daughters very young in life to wipe from front to back. If we look to the right, there's the uterus, the lining, the endometrium. And every month, the menstrual cycle, this thickens and prepares for implantation. But if it's displaced into the uterine tube, fallopian tube, same thing, it continues to thicken, but now we have an obstruction. Cervical cancer is this region of rapid cell division near the tip of the uterus, and that's why we do a pap smear or cervical smear to look for those cancerous cells that may develop. Ovarian cysts are sometimes just eggs or ova that fill with fluid and collect in this area, and there may be many of them. It doesn't always mean there's cancer going on. For men, I mentioned the prostate, but prostate-specific antigen, if it becomes high in the bloodstream, that's indicative of cancer. The testicles may also develop cancer, and This tends to hit young men between the ages of 15 and 35. And finally, circumcision. There's some debate about the value of this, but that foreskin is removed, and it may reduce UTIs and cancer.